Good morning, and thank you for joining us for the July 21st COVID-19 virtual news conference. My name is Mariah Miracle, and I'm a public information officer working in the Humboldt County Joint Information Center. Today's panelists include Public Health Director Sofia Pereira and County Health Officer Dr. Ian Hoffman. I'll start with a very brief update from the Joint Information Center before our panelists take questions. As of yesterday's most recent dashboard update, a total of 4,798 Humboldt County residents have tested positive for COVID-19. 229 cases have been confirmed so far this month. And since the most recent news conference on June 30th, the county's reported 12 additional COVID-related hospitalizations and has recorded 3 deaths related to the virus. Anyone with questions about COVID-19 can reach out to the community information line at 441-5000. We're open Monday through Friday from 8 a.m. to 5 p.m. and we're happy to assist residents with locating vaccination sites or testing resources in English and Spanish, and can also just provide general information about COVID or connect you to a public health nurse if you have any confidential questions you'd like to ask. Now we'll hear from our panelists. Let's start with Public Health Director Sofia Pereira.
Thank you, everyone. I'm just going to give a brief update on what we've been up to in our Departmental Operations Center. As you may recall, we did transition from the Emergency Operations Center structure with the Sheriff's Office of Emergency Services to a DHHS-based Departmental Operations Center. Functionally, from an operations standpoint, this just means we're continuing the work that we've been doing around investigations, around testing, and vaccination. So that work has been going full speed ahead, and really our mobile vaccination effort has hit a really good stride. And we, as you probably have seen, we've been across the county. We have been going to churches, community centers, community events. We had a really great turnout at the Humboldt Crabs game that Senator McGuire was supporting, and the California Department of Public Health was supporting. We also do have another clinic with the Senator and CDPH this Saturday at the Arcata Farmers Market. And we also are going to have a presence the same day at the Fortuna Auto Expo. So really just grateful for these really key partnerships with community organizations and community leaders, because this is not just a public health DHHS effort. This is a community-wide effort, and we've really been seeing people show up. So really just want to express our gratitude. Thank you.
Thanks, Sophia. Dr. Hoffman.
Yeah, thanks, everyone. So I want to touch base on some things that have been changing in the last few weeks since we last met. Let's start off talking about the Delta variant, which I'm sure we're all aware is rapidly on the rise in our country and across the state of California. CDC has reported that 83% of new cases in the United States are Delta variant now. CDPH has said that as many as 50% or more in California are Delta variant in the past weeks. And many counties are reporting those same sort of numbers or higher across the state of California. Our most recent data from our whole genome sequencing here in Humboldt County suggests the Delta variant in June was about a quarter of the variants that we were sequencing. So we fully assume that this is here and circulating based on that data, both those trends nationwide in the state of California and our local data, and also just with the case numbers we're starting to see again in the last few days. We're seeing cases resurge, and it's very likely the introduction of the Delta variant. The Delta variant is more infectious than previous variants. Alpha variant was around 50% or more infectious than the original virus. This seems to be at least 60% or more infectious than the Alpha variant. And so by some accounts, it could be 5 to 8 times more infectious than the original virus, which means that for every person who gets infected, there's more potential for them to infect more and more people. The good news is, what we're seeing with the vaccine is that it is holding strong against all of the variants, including the Delta variant. And we continue to not see significant increases in hospitalizations or deaths with the Delta variant in the fully vaccinated population. This is really becoming a pandemic of the unvaccinated. We continue to see multiple hospitalizations, as Mariah mentioned, in the unvaccinated population, and younger folks, multiple people in the last few weeks who are in their 40s. Those trends, I think, will likely continue to hold, given what we know about vaccination, that we will see, primarily hospitalizations in the unvaccinated. But what we are also seeing, given this higher infectiousness, is that the Delta variant is also being seen in the fully vaccinated. Many counties have reported that as many as 50% or more of their Delta variant cases are in the fully vaccinated. While we don't have good numbers here locally, I would suspect that that will also hold true once we have more data locally. Part of that can be from the fact that some of these counties have more fully vaccinated people in them. So the virus is going to take an opportunity to infect anyone that it can. But I think what we are also seeing is that there is a higher potential for a Delta variant to infect the fully vaccinated. Another thing we're seeing that we hadn't necessarily seen previously is spread among the fully vaccinated. So those who are fully vaccinated, both spreading it to unvaccinated people and to other fully vaccinated people. So it's giving pause for sure around the country, around the state. Many health departments across the state have come out with new masking recommendations for everyone to consider going back to using masks indoors, even if you're fully vaccinated. And so we're currently up to about 20 counties who have issued a recommendation of that sort, to varying degrees of recommending that people continue to mask in public places. And our major concern as health officers across the state is for the unvaccinated population. And same here in Humboldt County, our concern is really for the unvaccinated population that is at greater risk, given that 50% of our population is unvaccinated at this point. Some of those being not eligible yet, but some of them either waiting for things or not having the opportunity yet to become vaccinated. Those are the main concerns for why those counties are putting in those masking recommendations. But I'd say there's also other concerns, things like businesses having to close when a fully vaccinated person becomes infected and then exposes other workers, childcare, daycares, healthcare settings where fully vaccinated people are potentially exposing and having to go into response testing for those, or going on lockdown in skilled nursing facilities that are seeing cases again in the fully vaccinated. So there are bigger implications. And so we will continue to look at those kind of recommendations for Humboldt County and see what sort of recommendations make sense going forward. Lastly, I just want to talk about vaccination efforts. As Sophia mentioned, we're working very hard to break down barriers, bring vaccine as close as possible to people. We want to encourage everyone to continue to get vaccinated. The vaccine is safe, it's highly effective. We know those hospitalization numbers and are way down in the extraordinarily low in the fully vaccinated group. So please go out and get vaccinated. I want to make a plea for anyone who is fully vaccinated and has family members, have colleagues, friends who are not vaccinated. Please talk to them. I think Iridian's piece in the North Coast Journal really spoke to how that personal connection works. We know that really works. So please reach out to those folks who are in your close network, and we will continue at the public health level to advocate for full FDA approval, as well as getting this into doctors' offices and pediatricians' offices, as we know that some of those barriers are really will have a large impact on people getting the vaccine. So thank you for your time and look forward to your questions.
Thank you, Dr. Hoffman. Now we'll take questions. Let's start with Thad Greenson from the Northwest Journal.
Thank you, Mariah. So I'm curious to hear from Dr. Hoffman, given what you just said about the Delta variant and, both increasing rates of infection in fully vaccinated individuals and increasing indications that they're able to transmit the virus too, what your recommendations would be for households with mixed vaccination status. So where, particularly where there's a vulnerable family member at home, or perhaps a child that's under the age of 12 and not yet eligible. How would you recommend those households modify their behavior to keep everyone safe?
Yeah, it's a great question, Thad. And I think that's, again, one of the reasons you're seeing some of these recommendations coming out from these other counties is, just we do have a large population who are not yet eligible. We have household members who are, vulnerable, and some of them may be vulnerable and not vaccinated, or even vulnerable and fully vaccinated. We want to protect those folks. I think the message that we've been trying to put out all along is that there are going to be many fully vaccinated people who continue to wear masks for those specific reasons: concern about ineligible family members, vulnerable family members, concern about variants. And so I think those messages have been out there, and people have been making their own choices. Now that we're seeing some of that data, I think we're trying to get that information out to the best of our ability, as we see how this is evolving, pretty rapidly in the past few weeks, really months, since the reopening of June 15th. And I think it's going to come down to a personal decision, like to a certain degree it has been all along, but just to have people have the information and decide for themselves, do they want to take that extra precaution, either to get vaccinated because of the concerns with Delta being so much higher than they were previously with the other variants, or to continue to wear a mask if you're a fully vaccinated individual. So.
Thanks.
Do any other reporters have follow-up questions about preventive measures for vaccinated versus unvaccinated folks?
Yeah, I do, from the Time Standard. So does Dr. Hoffman have any, would Humboldt County perhaps consider moving back to masking practices for fully vaccinated people when in public spaces indoors?
So, I think we're looking very closely at the data, both, national, statewide, and local data, and trying to make decisions that make sense. I think, as I've said in the past, it would, to move back to some sort of stricter mandate, or, some sort of, closure going backwards in terms of restrictions, I think would require a larger impact on the hospital system. I think we're in a phase of really educating people about what the risks are and letting them take their own risks. So, yes, we're looking at getting that information out as soon as possible about what the risks are looking like for, the unvaccinated and the fully vaccinated folks, given the Delta variant, getting information about the Delta variant out to our community, letting them know that it's here, that it's a quarter of cases in June and likely very much more now. And so, but, I don't think, I think it would be a high bar to mandate masking again, like LA has done. But I would stress that, those sorts of decisions were made in Los Angeles because of the impact it was having on their society. And so, could we get to that point again in Humboldt County? It's hard to say, but that's the sort of level that it would take to make a mandate for masking again.
Thank you.
Any other follow-ups on that topic?
I do. Just kind of piggybacking on that, I'm wondering specifically if there's, I know it would be hard to give me a number, but I'm really wondering what that threshold is in terms of, is it hospital capacity? Is it deaths? How many cases would that take? Like, what really would it take for Humboldt County to need to reconsider additional mandates, even if it's just masking?
Yeah, it would be in concert, obviously, with our hospital administrators who we're always in close contact with about the situation around COVID. I think hospital capacity is really a big one. It's hard to put numbers on things. More, are we able to take care of what's going on in our county? Is it posing a public health threat to have our hospitals so impacted by COVID that it's impacting other things in the hospitals and other health outcomes? So, certainly the first measure would be masking, because it's a very effective measure. It's immediate, and it's spread of the virus, and it's something we've all been doing, so it's easy to go back to.
Any other follow-ups on that topic?
I do, Hector from Redwood News. I guess my question is, what are the recommendations for parents that are sending their kids to school that are coming up? Because I know the schools are reopening. So what are the recommendations there when it comes to the variant and them having to continue masking, or what are the recommendations there for parents?
Yeah, great. Thanks, Hector. So the recent CDPH guidance for K through 12 that came out does require masking for K through 12 settings, regardless of vaccination status. So that is the expectation by the state of California, just like it was last year, that schools will be masking indoors, optional for outdoors. But currently CDC states that if you're in an area of high transmission, that you should consider masking outdoors as well, which Humboldt County has been in substantial or high transmission since we went to reopening on June 15th. So that recommendation has been there throughout the summer, that youth programs should be masking in outdoor settings when distancing is not possible. So what that'll look like for the fall will really depend on what our numbers look like. And CDPH points to that CDC guidance for outdoor settings. So yeah, I think that's, we're not gonna be following any more strict guidance here in Humboldt County. We're really trying to follow that CDPH and CDC guidance at this point, unless there were significant factors like we were speaking about earlier, where it would, probably be a more widespread recommendation across the whole community.
All right, we'll go back to Isabella Vanderheiden from the Times-Standard.
Thank you. So according to a press statement from Tuesday, the CDPH said, as communication outreach efforts become more targeted, zip codes with low rates of vaccination and communities experiencing outbreaks will drive efforts through public education, provider programs, and community events. So what does this mean for Humboldt County? And given our high case rate and low vaccination rates, what is Humboldt County doing specifically to ramp up outreach and education efforts?
Sure. I'll kick this off, and if you have anything to add, feel free to chime in. So with our mobile vaccination effort, it really has been looking at, where the greatest need is throughout the county. So this may be geographic need, making sure that we're reducing transportation barriers by going to communities that maybe have not been able to make it to kind of the urban centers of the county. And also looking at, any type of, making sure that we're reaching different community groups and reaching different demographics. So for example, when we had vaccinations at the Humboldt Crabs game, that was able to reach a wide breadth of community members. Baseball is something that brings people together. We have our mobile vaccine team is going to be out in, there's a community cleanup in Northern Arcata with the Kuna community group. And so, just really just going where the needs are, and community partners have been really key in that, making sure that we're reaching the Spanish speaking population, making sure that we're reaching, the younger demographic as well through community events. So we're just going where the need is. We've been to senior centers. We have been doing homeless outreach. Open Door has been a really great partner in that. And so, we've been participating in that as well with our mobile team. So it's just a really varied approach. We're just making sure that we're keeping the team busy, making sure that we're reaching different parts of the county. And it's important for us to be looking at that data. We do look at the data, like where have we been? Where do we need to go back to? And where have we not been to yet that we need to have a presence in?
I guess I would just follow that with, are you seeing any kind of correlation with lower vaccination rates in more rural communities, or just, speak to that issue?
Ian, did you want to go?
Yeah, I can talk to that. I think everyone's focused right now on how do we get more people vaccinated, and we are not seeing the kinds of numbers that we did 2 and 3 months ago. Obviously, we're still vaccinating people every week, which is great. There are those people who meet those sort of the barriers of there was a transportation barrier. There was, if we come closer to their community, they weren't necessarily waiting. Maybe they didn't have time. They didn't have money to buy gas. All those things that we've talked about. The personal connection, some of those people have definitely been converted. I think Delta variant has converted a significant number of people. Vaccinations have gone up across the country in the last week with the news of the Delta variant. And, I think rightfully so, this is a concern, and people should be concerned. And vaccination is a great tool to prevent the Delta variant and prevent outcomes. So we're continuing to try to get to those communities. There are certainly a lot of reports out there, surveys looking at things like rural versus urban divides, religious affiliations, political affiliations. What can we do to start to break down some of those barriers? Some of those, like I mentioned, I think come down to things like FDA approval, which is something that we will continue to push on from a public health perspective to get it as soon as possible, because half of our country has now received the vaccine. It is safe, it is effective, and it should have full FDA approval. And then locally, just in California, getting it into doctors' offices, because again, that's another thing. I think that there are a group of people who won't get the vaccine until their doctor recommends it. So getting the word out to doctors too, even before it's in your office, get it out, get the word out there, and advise your patients to go to a public health clinic or to go to a pharmacy and get it. Don't wait till it's in your office. And then there's that portion of the population that just can't get it yet. And so we're waiting for that under 12 approval, which we hope to see sometime in the fall. So I think all of those factors, any one of those changes, and we'll see some significant movement on things. The things that we're chipping away right now are the little things like the personal connections and the physical and transportation and, financial barriers that are out there for people who just, they're not as motivated to go out of their way to get the vaccine.
Thank you.
Thanks, Isabella. Any follow-ups on vaccine outreach?
I do have a follow-up on vaccine outreach. Thank you.
Yeah, go ahead, Ryan.
I'm wondering what types of incentives are available. I've seen, there's the crabs game. We're aware of that. I see farmers market cash is available this weekend. That's exciting. There's gift certificates have been mentioned, but I wanted to see if there was any additional things that are happening that people could be aware of. And also if you can speak to whether or not there are Spanish-speaking volunteers or staff members available at each of these pop-up clinics sites. Thank you.
Yeah, so to answer your last question, yes, our SNAP nurse team does have Spanish-speaking staff. And then we do make sure at any of the clinics that we are running that we also have Spanish-speaking volunteers. So that is definitely a priority for us. So thank you for asking for that, because I think that would be helpful for the community to know that is a priority. And then in terms of incentives, I mean, you listed off already a number of the incentives that are being offered, that the state is offering. We're definitely looking at, how, we're working with the state to see if there's other incentives to really help reduce those barriers, whether it's gas cards, things like that. So we're looking at, what are funding opportunities to provide those barrier reducing incentives.
And I add to that, we're always looking for new incentives, whatever will reach the population. I think right now there are a couple of groups that are pretty static, which have a large number of people, and that's the young under 30 folks, so between age 12 and 30. And so we're looking for better ways to try to motivate them to get in for an appointment for a vaccine, going out to places where they might be in higher numbers, incentives that might get them in the door. I think the other groups, like I mentioned, just the folks who might be on the fence for waiting for some other thing, trying to look for ways to motivate them before, say, the FDA approval or before it gets into their doctor's office, because those things are taking time, and we know that the longer they wait, the higher the risk is. So anyone with ideas, we're happy to partner, like we did with the crabs for the tickets and the hot dog giveaway. There are a lot of potential opportunities out there. So please reach out to us if you want to partner on any of this.
Thank you.
Thank you, Ryan. Any additional follow-ups on vaccine outreach?
I have a follow-up. Is there any other reasons, like aside from the barriers that you guys mentioned, like say misinformation or misconceptions about the vaccine that are attributing to the lower rates in vaccinations?
I think that misinformation is certainly a part of it. I don't think it's the biggest thing. I think there are many other things that are out there. And that's backed up by some surveys that have been done across the country, looking at what people's barriers are, that the misinformation is actually one of the smaller things. Although we have worked to try to get that out there. The Northern California Health Officers Association, Rancho, put out a joint statement last week that, what the most common myths are, and trying to address each of those. So if you haven't seen that, please take a look at that. And the JIC and Mariah helped put out some really nice graphics that I think are going out really soon, if they haven't already been put on social media, that could be shared around those. We've worked with partners in the Spanish language community to also address some of those myths. So we're trying to get that word out. I think there are some people who could be moved with those, but it's it's one part of many things that we're doing to try to get vaccination efforts up across the county.
Thanks, Hector. We're actually coming back to you for a question. If you have an additional question you'd like to ask.
All right. I guess my question here is, since we've seen you mentioned that there was like a fourth of the cases that are related to the Delta variant that we've seen as of late. Do you guys know where those cases are coming from? Is it from people that are in large gatherings, people that are unvaccinated or not wearing masks, or kind of where are those cases coming from?
Yeah, so the vast majority of cases still continue to be from gatherings, mostly gatherings of people that include unvaccinated. There still continue to be some community spread, people who say they don't have any other risk factors, but that tends to be a small number overall. I think we have seen an increase in the fully vaccinated with the Delta. And I think, again, that's something that we're seeing across the state and across the country that's a little concerning that we hadn't seen previously. So, whether or not that also is just, like Marin County is seeing a huge increase in the Delta variant in the fully vaccinated because they have so many vaccinated people, is that, we have half of our county vaccinated, that could be confounding it a little bit. But there's still concern there that, this is starting to spread among fully vaccinated folks. And again, more for them, the impact on their daily lives than strong concern for their overall health. I think that, the vaccine is very protective of those people who are fully vaccinated from severe outcomes, but it is having tremendous impact on, families taking time off who were trying to do their best by being fully vaccinated, having to take time off to take care of children, to, close daycares, close camps, close businesses. These things will continue as the Delta variant spreads among our community.
Any follow-ups on that topic? All right. Riley Carroll from North Coast News.
Thanks so much. Pretty much everything has been answered. Just wanted to check quickly on hospital capacity, just to check in how the hospital's doing with the increase in cases and little uptick in hospitalizations.
Yeah, we keep close eye on that every day, checking in with the hospitals about the numbers of COVID cases. And periodically checking in with the administrators at those hospitals, to see what their concerns are. So right now, no concern for our ability to care for our community, but something we continue to monitor very closely on a daily basis.
Great, thank you so much.
Welcome.
Thanks, Riley. Any additional questions on hospitalizations or capacity overall? All right. K-Mud, all right. Ryan Hudson from Redheaded Black Belt.
Hi. Let's see. Well, I'm thinking about this new information that's showing vaccinated people are able to spread this Delta variant. And I did read that San Francisco has required, at-risk workers like healthcare staff, jail staff, nursing home staff. They've basically required those folks to get vaccinated, or I suppose risk losing their job, as the LA Times put it. So just looking at Humboldt County, do you foresee any kind of mandate like that being incorporated into county business or schools or hospitals or anything of that nature?
Yeah, it's a great question, and another piece of this that can really move the dial quite a bit on people on vaccination. So we know that in places where they have required or mandated vaccination, either in a business or university, the rates go up tremendously. There's one story of a healthcare entity that required vaccination, and they were able to get well over 95% of their employees fully vaccinated with that. There's definitely some legal concerns. There are organizations who have, taken that up either way. There are legal challenges in the courts. The latest one was upheld, though, so that portends well for the for those mandates by a business or university or employer. As a public health department, we can't mandate vaccination in the population, but those are things that employers, I know some have looked at it locally, and some are going to wait for FDA approval. That's something that we are hearing from many of those employers in healthcare and in education, that once there is full FDA approval, they will feel much more confident in making those mandates for their institution. So again, I think that's another reason that FDA approval is so crucial right now, and we're hoping that it can speed up.
Thank you.
Thank you, Ryan. Any follow-ups on that topic? All right, I think we have time for each reporter to ask an additional question. We'll start back with Thad Greenson from the North Coast Journal.
Thanks, Mariah. So Dr. Hoffman, I'm curious, a couple times you have mentioned just limitations in getting local real-time data regarding both breakthrough cases and cases of the Delta variant. And so for each of those, I'm just hoping you can explain to folks why that's what the hurdles are and getting kind of more recent data or more real-time data on those two trends.
Yeah, so we collect tremendous amounts of data on COVID every day. When you think about all the things that are on the dashboard having to be verified, we have the investigations team who are talking to all of the cases and contacts across the county every day, gathering data from them about their contacts, verifying whether or not they're vaccinated, looking through records. So it's already a tremendous amount of work. That's on one piece for the whole genome sequencing. We just started doing that in our own county in the past few weeks. It is going really, really well. But again, that's something that is taking up a tremendous amount of time from our lab standpoint. And so as we get more confident with that, we are feeling more confident about sharing that data, more broadly. So we are looking at a way to share publicly the variant data. And so that's something that, I think we can look forward to at some point in the near future. But because of the nature of both vaccination verification and whole genomic sequencing being a lot of time and effort, it's a huge ask for us to put out, those sorts of data points on a regular basis. So we look at them internally. When we feel confident about trends or numbers, we put that out in the media. And so I think that's the way we're going to continue to do it, is, with trends rather than specific number of cases, say, because of the hurdles to verify all of that. And just on I'll give you an example for the whole genome sequencing. It takes nearly a week for us to go through a cycle of genomic sequencing for, anywhere from 20 to 30 samples. the machines run from anywhere from a day to 3 days. And then there are several days of data crunching that have to happen to verify and make sure that the data is correct. And then we also have to put that in with what we know about those particular patients, which cases they were involved with, trying to look at whether they are vaccinated or not, where they relate to other cases within our county, within the state of California, within the world genomic sequencing data that's out there. It's a massive database. And so that kind of gives you a sense of how much we're dealing with right now. But we will continue to try to get that out as timely as we can in a way that informs the public what is going on, both with the variants and with breakthrough cases.
Excellent. That's really helpful. I appreciate it. And just a quick follow-up. Yesterday, the JIC released breakthrough case information regarding fatalities and hospitalizations. But I'm wondering, just because I've been asked repeatedly by readers, if you have any estimate as to, just as when we kind of look at the recent case surge, what percentage, if you could hazard a guess, is our breakthrough cases?
Well, based on what we're seeing across the state, I think a county like ours is just, we're always a little bit behind everyone else because of our geographic location in the state. There's physical barriers between us and other places that have higher cases. But if you look at LA and the Bay Area, where they're seeing much higher numbers of breakthrough cases, above 50% in some of those counties, I think we could be headed in that direction for sure, which is one of the reasons, again, the health officers across the state are concerned in putting out these alerts to the vaccinated to consider to continue masking. If I had to hazard a guess, it probably were somewhere closer to the other counties that are experiencing 20, 30% as breakthrough cases. When we can verify some of that, we'll definitely get it out into the media and let folks know. But that would be, just again, based on what we know. And I think that'll increase over time, given that what we know about Delta and what we know about, how it's behaving in those communities as well.
Great, thank you.
Thank you, Thad. Isabella Vanderheiden from the Times Standard, do you have an additional question?
Yeah, I suppose I would just ask Dr. Hoffman what his thoughts are on booster shots.
Great question, Isabella. So currently, there are a lot of trials going on around booster shots. There are studies of mix and match shots going on. This is, really more of a national level policy thing. So I'm just going based off of what is out there in the media, but, we've all seen Pfizer has applied for a booster shot and so far has not been approved for it by the FDA. I think that everyone's watching it really closely. We're going to need really solid data to recommend that at a public health level, though. That's something that, again, the scrutiny of level that we need to have these sort of recommendations, we're going to go through the proper channels, we're going to study it, and when it has enough data to support it, I'm sure the FDA will approve that and the CDC will get behind it, but we're just not there yet for booster shots. And I think that, if you look at the data for all 3 vaccines with Delta, again, there might be some marginal decrease in effectiveness against symptomatic disease. So again, these fully vaccinated breakthrough cases that we're seeing are, many of them symptomatic. That's what we're seeing locally is all of them, actually, all of our breakthrough cases have been symptomatic. Sorry, I shouldn't say that entirely. So with the more infectious variants that we're looking at with Alpha and Delta, we have only seen those ones in symptomatic folks. So we, I think that, but they're not getting hospitalized. That's the main point. They're not getting hospitalized, they're not dying. So the vaccines are performing still very, very well in that way. What they're losing some effectiveness is on, getting cold-like symptoms, getting fever, chills, sinus type, in fact, cough, all the things that we know come along with it. But, we are not yet seeing any concerning evidence that they are not performing well against hospitalization and death. And I think that's really the key point, because if we were seeing that, I think the threshold would probably lower tremendously for considering some sort of booster shot.
Thank you.
Thank you, Isabella. Hector Mendoza from Redwood News.
I have no further questions. Thank you.
Thanks, Hector. Riley Carroll from North Coast News.
No further questions. Thanks so much, Maria.
Of course. Thanks, Riley. And Ryan from Redheaded Black Belt. Any additional questions?
Yes, I do. If you could clarify for me, Dr. Hoffman, I read in the press release yesterday that it said only 2 of the 222 hospitalizations in Humboldt were of fully vaccinated residents. So those are then breakthrough cases that were hospitalized. Is that correct?
Yes, that is correct.
Okay. I wonder if you can share this with me or not. I'm not sure if this is a HIPAA concern, but I do want to try. Were they admitted for COVID, or were they admitted and then happened to test positive because they were admitted for some other reason?
We only count hospitalizations that are hospitalized for COVID. So if someone gets hospitalized, they test positive for COVID, but they're there for some completely other reason, they don't have any COVID-like symptoms, they do not go into our hospitalization count. This is a difference at the local level versus the state level, because the state cannot verify that like we can. So when you look at some of the state numbers, like you might see higher numbers for the fully vaccinated hospitalizations and even deaths. So we have that ability as a local health jurisdiction to look at that more closely. And so yes, everyone who's included in our case count for hospitalizations was hospitalized for COVID. That might not be the only reason they were there, but they were hospitalized for COVID as at the very least, if not for other things.
Okay.
So, and I would point out that 2 out of 222 hospitalizations is a really powerful number when you think about the power of the vaccine at preventing hospitalization. It means you're really 100 times more likely to get hospitalized if you're unvaccinated, and that's why we really want people to get the vaccine. It's safe, and that those numbers point to its effectiveness.
Thank you.
Thank you, Ryan, and thanks to all the reporters for joining us today, and to our panelists for answering questions. I will get the recording sent to media representatives as soon as possible. Thanks, everyone, and have a great day.